ADHD in the classroom. Let's talk about the facts, statistics, and classroom management techniques. The purpose of this presentation is to give you a better understanding of what students with ADHD go through and how we can help them succeed. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurological disorder that causes inattentiveness, hyperactivity, and impulsiveness. It is most often seen in children ages 4 through 17. Most children are diagnosed around age 7, and the symptoms can change or digress over time. ADHD is not a gender-specific disorder. It affects both males and females. This disorder can be treated and is manageable when the proper treatment plan is put into action. ADHD was first mentioned in 1902. A British pediatrician, Sir George Still, described it as an abnormal defect of moral control in children. This disorder went from being called hyperkinetic impulse disorder to attention deficit disorder, or ADD. ADD was separated into categories depending on which symptoms were more noticeable. In 1987, the name changed again to ADHD. Medication for ADHD was first available in 1936 with a prescription drug called Benzedrine. The next was Ritalin, which came around 1955 and is still used today. The diagnoses for ADHD have steadily increased since the 1990s, and this is most likely due to people being more aware of the symptoms and doctors having a better idea of this disorder. On this slide, I have included an image that gives an inside look at the difference between a person who has ADHD versus someone who does not. It is well known that the brain is a complex organ and can be altered by outside factors. When a person has ADHD, his or her brain receives and stores information differently. For people with ADHD, the inside world, or internal world, which is emotional, thought processing, memory storing part of the brain, thrives, but the external world, or the part of the brain that listens, recalls recent information, and focuses on a task, tends to struggle. Stress, anxiety, and defiant behaviors are common side effects for those with ADHD. It is common for students to have tremendous stress over certain assignments such as tests, reading assignments, or speaking in front of the class. It is common for people with ADHD to have social anxiety or anxiety disorder because they often struggle to make friends or perform the same way their classmates and peers do. Defiant, or bad, behavior is just a byproduct of the typical stress and anxiety these students go through. When you are working in the classroom, remember to try and be supportive and patient with those students. ADHD commonly occurs alongside other disorders and can be greatly impacted by things like toxic relationships, negative interactions, and a dysfunctional home. Here are some of the most common challenges students with ADHD will go through. People who have ADHD often have poor decision-making skills and tend to act out of impulse. School is often a big struggle, and besides the issues they face inside the classroom, they are also more likely to face issues like bullying, failing grades, and getting in trouble. Other challenges include interacting with others, remembering information, and focusing on what is happening in the moment. Let's look at some of the advantages to having ADHD. For example, people with ADHD are often extremely creative and have very vivid imaginations. They learn practical skills like how to stay organized and being on time rather quickly. Students are known for showing kindness and compassion to their classmates. An important thing to realize is that this disorder can make even the simplest task seem unconquerable. But in some of these cases, like the ones I've listed right here, weaknesses can become strengths. Know that your students with ADHD may struggle, but they are also going to try their very best to succeed. On this slide, I have included a few statistics that go along with the information we have already covered. 7 is the average age a child is diagnosed with ADHD, and children typically start to show symptoms of this disorder between the ages of 3 and 6. 6.1% of American children are being treated for ADHD with medication, and over the past 8 years, there has been a 42% increase of ADHD diagnoses. In the United States, 62% of children between the ages of 2 and 17 who have ADHD are treated with medication, and 47% have received some type of behavioral treatment in the past year. 64% of children in America have other mental, emotional, or behavioral disorders along with ADHD. ADHD is a disorder that has multiple treatment options and often becomes easily managed over time. One of the more common treatments is prescription medication. Some people choose to take a more natural approach by using essential oils, avoiding processed foods, or trying acupuncture. Behavioral methods are also common and can be effective for some people. It is very important for those with ADHD to meet regularly with their doctors, teachers, counselors, and other trained professionals to make sure the preferred treatment is working properly. Here are a few management tips that help students with ADHD. Teachers, when you have a student or students who have ADHD, you want to give simple, precise instructions. Try to maintain a normal class schedule to provide consistency as often as possible. Give plenty of examples and illustrations with your assignments, and allow time for questions after you have explained. If a child knows that they will have the opportunity to ask questions, they are more likely to wait and interrupt you less. Students with ADHD will most likely have a 504 plan that can include accommodations such as extended time on tests and going to a quiet room to work. Being aware of methods that will help your student succeed is an important part of the job. Get creative and be willing to try new things in order to help your students accomplish more. Remember, when assigning homework, that a student with ADHD will struggle just as much, if not more, at home than they do at school. If a child comes into your classroom and is hungry, dirty, or tired, it will be hard for them to concentrate. If you notice a student struggling more than usual, look for these factors and see what can be done to help them. Providing certain resources like a planner or journal can help them learn to stay organized. If you have a student who is frequently speaking out in class or being disruptive, try the journal method. Give the child a journal and have them write down any thoughts or ideas they have throughout the day. Allow them to ask questions, but have them keep all thoughts to themselves. This might help them from speaking out in class and being a distraction to others. Teachers, remember that you are not alone, and caring for students is a team effort. It is important to keep regular contact with students' parents. Staying connected will help the parents keep the doctors and other professionals updated on how certain treatments are working. Being supportive is extremely important because those with ADHD are constantly comparing themselves to others and typically feel like they come up short. If you provide frequent positive feedback, your students can gain the confidence they need to succeed. Celebrating small achievements will only encourage them to work harder and not give up. Here are some extra resources to use in the classroom. If you have students who struggle with staying in their seats, try some of these nifty chairs right up here and see if that helps them stay where they need to be. Playing classical music in the background has been proven to help concentration, but it is not always needed. Background music is a great way to reduce distractions, but will not help every student. The interview I have listed here, ADHD child versus non-ADHD child, is a great YouTube video that gives an inside look at how a child with ADHD views school versus a child without ADHD. The interview consists of two first graders who were asked a series of questions in this short video. ADHD is a disorder that can make children feel isolated or alone, just like many other disorders. Bringing in guest speakers or even the guidance counselor at your school to talk to the class about different learning disabilities can be a great way to educate all students on common issues their classmates face and learn how to be inclusive. Here is a list of the journals and books referenced throughout this presentation. I hope that you can take some of the presented information and use it to create an effective learning environment and keep your classroom a fun, safe, educational space for all of your students.